Have you had a prolonged erection before? Or has somebody who has had that condition shared their experience with you? Most men who've had a prolonged erection describe it as a frustrating, sometimes painful and uncomfortable experience. What really is a prolonged erection and what causes it? Who are those that are more likely to get it? And is it possible to prevent it? Why not stay around to the end of this video where I hope to answer some of these questions and more. Hello, welcome back to my channel. I'm Dr. Sylvia, a general practitioner and educator. This is Ask Away Health, where we provide you with directions and clarity about everything medical. Please subscribe to my channel, and when you do, don't forget to click the notification bell so that every time we publish a new video, which tends to be once a week on Saturdays, you'll be one of the first to know about it. Firstly, an erection is essential for the sexual functioning of a man. An erection happens when, following sexual arousal, the shaft of the penis becomes erect or rigid because it is filled with blood. Afterwards, or after sexual intercourse, what happens normally is that blood flows out of the penis and it softens. However, sometimes in some people, the penis can remain erect or rigid for a prolonged period of time. Now, when the prolonged erection of the penis carries on or persists for longer than 4 hours, this becomes a serious medical condition. It's also known as priapism. Now, how does a prolonged erection happen? There are two ways that we know. In one case, at the time of sexual arousal, too much blood flows uncontrollably into the shaft of the penis, leading to the erection. And in the second case, at the end of sexual intercourse, the blood does not flow back out of the shaft of the penis, and in other words, the blood stays inside the shaft, maintaining or prolonging the erection. So now that we know what a prolonged erection is and how it happens, let's look at some specific questions that people who have experienced this condition often ask when they come to see their doctor. So the first question is this: is a prolonged erection always painful? A prolonged erection can be painful, but not always. It depends on the cause. It can be painful if blood fails to flow back out of the shaft of the penis. This is known as low flow priapism. It might be caused by some drugs or certain medical conditions, which we'll look at in a little bit. But in another form of priapism, and this is where people experience a prolonged erection because of an uncontrolled flow of blood into the shaft of the penis, there may not be pain associated with this instance. This is also known as high flow priapism, and in this situation, the penis will remain erect but not rigid. Now, the second common question that many people ask about a prolonged erection is: who can develop or who can get a prolonged erection? And the answer to this is it can happen to men at any age. In children, the most common cause of a prolonged erection are conditions like sickle cell anemia, or if there is cancer like leukemia. In adult men, low flow priapism, which we've just described as when there is failure of the blood to flow back out of the shaft of the penis, could be caused by different conditions. One of them is drugs used to treat conditions like depression or schizophrenia. Men who use stimulants like cocaine or other performance enhancing medication or high levels of testosterone are also at an increased risk of developing low flow priapism. In addition, low flow priapism could also occur in medical conditions such as sickle cell anemia, thalassemia, which are blood disorders, cancers like leukemia, as well as prostate or bladder cancer. How about high flow priapism? Now, high flow priapism develops commonly as a result of injury to the penis. This could be from rough or vigorous sexual activity. It can also be as a result of injury or disease to that part of the body known as the perineum, which is that part of the body between the anus or the anal opening and the bottom or the base of the penis. And such injuries could be from a collision with a hard object, falling astride, or a painful kick to the genital area, or a cycling injury could result in injuries to the penis that cause high flow priapism. And some forms of injury to the brain or spinal cord can result in a loss of the control of signals which control the flow of blood in the penis, and that can lead to high flow priapism. Another commonly asked question is whether normal potency is possible after a person has experienced a prolonged erection. And the answer to this is yes, but it does depend on how long the prolonged erection or priapism occurred. And so, the shorter the duration, the more likely the recovery of an individual's potency. If the cause of priapism is linked to the use or misuse of alcohol or certain drugs as we've described earlier, then the recovery of potency in such instances is less likely. And so what we advise is that men who have experienced priapism or prolonged erection in the past are likely to have problems with erection in the future. And the last question I'm going to deal with today, which I think is important when considering the whole issue of prolonged erection, is why is it important to seek urgent medical attention if you develop a prolonged erection? And the reason for this is because the cause of the prolonged erection might be as a result of a disease which needs urgent treatment. Having a prolonged erection, particularly more than 4 hours, can disfigure the penis and can contribute towards the loss of potency. It can also result in damage to the tissues of the penis as a result of oxygen lack during the period of the prolonged erection. And in severe cases of tissue damage, the only solution at that point might be for amputation of the penis. And so to conclude, while a discussion about problems with erection can be potentially embarrassing, it's important to have a chat with your doctor, because in some cases it might not correct itself, and like I said, it might be a symptom of a disease that needs urgent assessment. Let me know if you have any questions in the comment section below. If you found the video was useful, do please put a like on it and share with somebody else who you think might find it useful. Thank you for watching, especially if this is the first time you're joining or coming across my videos. Please consider subscribing and don't forget to click the notification bell so that you would know every time we publish a new video. And if you found this useful, then why not have a look at the video I have on premature ejaculation. I will share the link to that video in the description box below. So once again, thank you for watching. Please stay well and I will see you again soon.